Okay, class, it's Mrs. Poffenberger again, and now we're going to start into the second part of our dissection, which is looking at the internal structures of the heart. So we're now going to be making some cuts to look at all the different parts of the internal anatomy of the heart. So again, here we have our pig heart. We're in the anterior view. I'm going to turn it over to the posterior view, and I'm going to find the superior vena cava, which is right here. And I'm going to take my scissors and I'm going to cut downward through the atrial wall, starting at the vena cava. So I'm going to make a cut here, going down through the atrial wall and open that up. Okay, so as you can see, I'm down through the atrial wall. You can start to see the tricuspid valve that would be in there. And I'll cut maybe just a little deeper just to open it up to see it a little bit better, hopefully. Okay, so hopefully you can see down in there into the tricuspid valve. So next thing I'm going to try to do is see if this tricuspid valve will work at all. It may not, sometimes depending on how long hearts have been preserved or how the preservative affects the myocardium. They might not function the way that they should. But I'm going to pour some water down in there. A little much. And we're going to see if we have any pumping action in the tricuspid valve. Yeah, so there doesn't appear to be a lot of action occurring, but normally those flaps would open and close as you're pressing on the ventricle. So as you're pressing on the ventricle, they would open. As you let it relax, they would close. Or I'm sorry, the opposite of that. When you're pressing on the ventricle, they would close, and when you're not pressing, they would open, so that the blood can go from the atria down into the ventricle. So I'll just pour out this water here real quickly. Oh, maybe. And then we're going to continue on here with our dissection. So we're going to continue cutting downward through that valve, that tricuspid valve. And we're going to cut here down through the right atrium, right ventricle, right ventricular wall. And we're going to go, excuse me, to the apex of the heart. So we're going to cut down through and stop at the apex. And the wall of the ventricle is pretty thick. So it's going to take a little bit of effort to get down through that ventricular wall. But just kind of make some cuts, pull open, and you should be able to start making some headway down through. So we're pretty much down through the ventricle here at the apex. And you can pull it somewhat open there, and you can then see the atria and the ventricle on the right side of the heart. You can also see here those heartstrings, the chordae tendineae would be right in here. So you can see those, and we're going to cut through those so I can open it up a little bit better, but you can see how they're attached there to the inside of the heart chamber. So again, right atrium up here, tricuspid valve, and right ventricle. So we'll pull this down through and open it up a little bit more so that we can see those structures in a little more detail. So you can look at the structure there of the atria, looking at the tricuspid valve here, and looking at the right ventricle, looking at the walls there. Okay, so I did cut through the chordae tendineae there. You can still see the chordae tendineae of the tricuspid valve. So here's our tricuspid valve that you can see there. And you can sort of see the three cusps. So there's one, and there's one. And again, all of this area up here is the right atrium. All of this area down here is the right ventricle. You can see the thickness there of the myocardium of the right ventricle. And you can just look at the structure. Similarities, it is sort of fibrous, you can see, and muscular in both the atrium and ventricle, but ventricle much more muscular. So now we're going to cut upward through the right ventricle, and we're going to try to see the pulmonary valve. So here's the pulmonary artery right here. Here's the right ventricle, and here's the atria, but here's the right ventricle that's going to go up into that pulmonary artery. So again, thick area here, but you'll sort of cut through and see if we can see that pulmonary artery or pulmonary valve. Cut through some of that fat and tissue there as we're dissecting that away. So that's just fat right there. We can free up the aorta here from that pulmonary artery. Sorry, stuff's shifting on me a little bit because the heart is quite slippery because of all of that fat. So there you can see this is the aorta separated there. Here's the pulmonary artery getting separated a little bit, as you can see there. So now we can see the pulmonary artery a little better. Right in here. So trying to cut again upward toward that pulmonary artery, which is a little tricky. Separate that fat there. And we might actually flip it over to the anterior and go this way and see if we can see it. This way might be a little easier. Yeah, a little easier to go anteriorly there. So now we can see that pulmonary valve down in there. And we even have a little bit of coagulated blood there that we're removing. But there would be the pulmonary valve leading from the right ventricle to the pulmonary artery. And you can see the leaflets there. We'll cut down a little further. And there you can still see, yep, that pulmonary valve. So again, pulmonary artery here, pulmonary valve. Okay, now we're gonna go, so we, again, cut through the pulmonary artery. We see the pulmonary valve there. So now we're gonna go and we're gonna cut through the left side of the heart. So I'm gonna turn it back over to the posterior side, posterior surface, and we're going to go from the left atria down through the left ventricle to the apex of the heart here again. So we're just gonna start up here at the wall of the left atria. So put your scissors in the wall of the left atria and just cutting down through the atria, their atrium. And then we're gonna go again through the ventricle. And again, it's quite difficult to cut because it's a very large, thick muscle of the ventricle. So your hands, my hands are getting pretty tired. So your hands will probably hurt a little bit after going through the left ventricle. You can also use your scalpel there to help you if it's a little difficult with the scissors, at least to make a path. Again, make sure you're always cutting away. And then you can open up that left ventricle. All right, so there we go. So opened up the right, or the left atrium, and opened up the left ventricle. And we also have a lot of coagulated blood there as well in the valve. So we can see here, again, left atrium, we can see the bicuspid or mitral valve. We can see all of those heartstrings, all of those chordae tendineae of the tricuspid valve. And I'm going to just pull it open a little further and rip through those heartstrings a little bit more so we can see more of the heart. So here we have that valve. That bicuspid valve only has 2 flaps. A little hard to see when you rip the valve open, but here's the one flap, and over here will be the other flap. You can see the atria has a pretty smooth wall. And ventricle, look how thick that ventricle is. That left ventricle. Very, very thick myocardium in the left ventricle. If we compare to the right ventricle, there's the myocardium. Look at that left ventricle, so much thicker than the right ventricle, because remember, the left ventricle has to pump its blood to the aorta and to the entire body, so it needs to be a very powerful pumping muscle. And then again, looking just at the chamber, the ventricular chamber there, and looking at the structure of it. So again, left atrium, bicuspid or mitral valve, right ventricle, and the wall of the right, or not right ventricle, left ventricle, and the wall, excuse me, of the left ventricle. We can also see and try to figure out where those pulmonary veins are entering. So here we can see from the outside, there's one pulmonary vein. Looking at another one here. Yep, there's the second one. Coming up here, third one. Then I think the fourth was over here. So we can see all those pulmonary veins, and we can see if we put the probe through, you can see that they're coming into that right, or that left atrium. So bringing back blood back from the lungs. Okay, so again, we looked at the left side of the heart, so the left ventricle, left atrium, bicuspid valve, left ventricle. Now we're going to compare and look at the aorta and the pulmonary artery. So here we can see the aorta, looking at the wall of the aorta and looking at its thickness, and that pulmonary artery. So we did cut the pulmonary artery, but you can see, excuse me, the thickness of that wall. So they're relatively similar in thickness, and that sort of makes sense. The aorta is probably a little thicker because it needs to be a little more muscular to pump or to help transport blood throughout the body. than the pulmonary artery, but they are both arteries, so their artery walls are going to be similar, especially in comparison to the vena cava and the pulmonary veins. Okay, so now we're going to look or open up the aorta, and we're going to look at the aortic valve. So we'll try to go to our best view here. So I'll cut a little bit away of this muscular wall there so we can dissect the aorta more. Okay, so now we have the aorta, being able to see that in full view, and you can sort of stick your finger down into the aorta to see where it would go into the left ventricle. So it's going to be going, it goes down into this left ventricle here. So I need to cut down through the aorta. And we are going to open that up and try to see the aortic valve, which we can there. Very nice aortic valve here we can see. Okay, so there we can see that aortic valve. We can see the leaflets. So it should have 3 leaflets there. And we can see that it's going down into the left ventricle. So you can put your finger down in there and feel around, and we can even see it come out the other side there. So we can see the we can see the aortic valve as we're going down through it. Okay, so again, that is the aorta and the aortic valve there. So we've pretty much seen all of the different parts of the heart there. The other part that you should look at and want to identify would be the electrical system. So where all the electrical system would be in the heart. And I'm going to make some cuts to open up the heart, and then we'll go over the electrical system. Okay, so I'm again at the posterior surface of the heart, or the posterior side of the heart. I removed a lot of that muscular part of the ventricles, the right and left ventricles, so that we can see both ventricles and atria and a lot of the structures of the heart, so we can go over the electrical system. Okay, because this is the posterior view of the heart, we will, it's kind of opposite of how you generally look at the electrical system. But since we had it open posteriorly, I just went ahead and opened it the rest of the way. So remember, this is the right side of the heart posteriorly. This is the left side of the heart. Anteriorly, this is the left side of the heart. This is the right side of the heart, okay? But again, so looking posteriorly, here we have the right atrium. So remember, the sinoatrial node would be found in this right atrium. And then the atrioventricular node is between the right atrium and the right ventricle, so about right in this area here. Then the AV bundle would be at the top of the intraventricular septum. So AV bundle here, and then the bundle branches they split from the AV bundle, two of them. There are 2 branches, and they would run down this intraventricular septum. And then the Purkinje fibers would be throughout the walls of the right ventricle and throughout the walls of the left ventricle. Okay, so again, SA node would be in here, AV node, AV bundle, bundle branches, Purkinje fibers. Okay. So lastly, just to review, make sure we know again where those major blood vessels, those great vessels of the heart, are located. So if we turn it over anteriorly, here's the pulmonary trunk, pulmonary artery right here. Now we did dissect it and cut it open, but that's pulmonary artery. Here's the aorta. Okay, flipping it over. Here was the vena cava. So superior and the inferior was down here. And then here are the pulmonary veins that are going into that left atrium. Okay, again, the valves on the right side, you have the tricuspid, left side, you have the bicuspid. In the aorta, you have the aortic. In the pulmonary, you have the pulmonary valve. So that concludes our dissection of the pig heart. I hope that you enjoyed the dissection, and I hope that you learned a lot about the anatomy and structure of the heart. Thanks so much for listening and watching, and have a great one. We'll see you later.